All righty. Good morning, everyone. My name is Juliet Rudder. I'm the Community Engagement and Outreach Coordinator with the Healthcare Coalition of Southern Oregon. And welcome to Wednesday of our community baby shower. Today is all about infant and parent mental health. Thank you for joining us. Today we are with Sara Eberly. And Sara is a parent-child interaction therapy clinical supervisor at Options for Southern Oregon. What that means is she trains and supervises other parent-child interaction therapy clinicians and also provides those services herself. Her niche is working with children under 5 and their families. She has been doing infant toddler mental health since 2013 and has been with Options as a therapist since 2007. As a personal tidbit, they went to Monterey for spring break and asked the people at the aquarium where they could kayak with otters. So over the break, they went kayaking with a raft and several rafts of sea otters. So I think that that's super, super cool and worth a mention. So yeah, welcome, Sara. Could you describe your organization?
Yeah, so I work at Options for Southern Oregon, and that is community mental health. It was originally based in Josephine County. In 2017, moved to Jackson County as well. So it provides mental health services for I think it's mainly All Care, Jackson Care Connect, and TriCare, TriStar, in other private insurances for both of the counties. So people can come in, refer themselves or get referrals from their doctors or schools, and come in for mental health assessment and then determine if they need treatment or not.
Awesome. And we mentioned a little bit about parent-child interaction therapy in your introduction. It's also known as PCIT. Could you give us an overview of what that's all about?
Yeah, I try not to use the acronyms or be at least aware of when I'm using the acronyms because there's a lot of them around. And I realized how much of a mouthful that was for you. I'm sorry. So PCIT, parent-child interaction therapy, is a evidence-based treatment geared for 2 to 7-year-olds, particularly because it's play-based. And so that is really kind of where it gets the most bang for its buck, is that age range. And it was originally developed for kids with disruptive behavior. So, tantrums, opposition, although there's lots and lots of research for its effectiveness for autism spectrum disorders, anxiety, depression, parent-child relations, trauma even. I've heard a term today, it's transdiagnostic, which kind of, again, can be beneficial, across a bunch of different diagnoses. And it's kind of exactly what it says, parent-child. So we're using play to improve behaviors in the first phase of treatment. So we're working on things like emotional regulation, frustration tolerance, attunement, and all through play. And then there's a second phase of treatment where we're kind of working on stop behaviors, and we're working on consistency, predictability, and follow through in discipline, kind of step by step. And so it's a lot of work for the parent. I say that it's a lot like learning a new language because you're learning to do things in a different way. But it is also really rewarding, and I still love doing it after, after a decade. So
Awesome. So there were two things that I wanted to make sure that we define. So like transdiagnostic, what does that mean in a definition form?
So like what I don't know, like what the like it can be effective. What I understand it as is it can be effective with different diagnoses. So like I said, like
Oh,
help with the autism spectrum disorder, and it can help with oppositional defiant disorder.
gotcha. Thank you. Yeah, I was like, wait, cool. And then you mentioned attunement, and we've talked about that before in our previous interviews, but for those who this is their first time, what does that mean?
Really, the attunement is just being able to be aware and work on matching someone else's mood and space. And so if you think about attunement with a baby, if they're tired and ready to snuggle into your arms, you're noticing that and using a quieter voice versus getting ready to bounce them and keep them up.
Gotcha, gotcha. Um, and I also appreciate you mentioning like it's like learning a new language. Is that like something that like parents will need to like learn just on their own, even if they don't come to you, or like what do you normally see in that sort of situation?
So, so like if people are coming to me or like when PCIT is recommended, what do I see? Is that what
Yeah,
the answer?
I think so.
I think a lot of things that I hear from parents where I recommend PCIT is they're tantruming all the time, and I don't know how to help them. I've tried all of these different types of discipline, and none of it works. Um, and so, what I think what PCIT does is it builds on some good parenting skills in general, and it expands them into really a therapeutic level.
Very cool. Thank you. Those just all came out of the previous question. um, so what are some ways that families can encourage mental health between parents and children in everyday situations?
Well, I think that going back to that attunement piece of and realizing that kids speak through their behavior. So just like babies are crying because they need something, toddlers are throwing a tantrum because they need something and they don't know how to ask for it. So and I guess the other piece that I say, it's so much easier to talk about what to do than to do what I'm saying. And so I tell my families a lot, like I teach this and I don't remember to do it all the time. So I think one of the one of the pieces is take care of yourself so that you can take care of them. Because if you can regulate, if you can take a minute during their tantrum and go, okay, what's going on? They're trying to tell me something. And you're like, oh, we've been in line for 15 minutes and we have all of this food that we're buying, and they refused breakfast this morning. I forgot that. You're going to respond a whole lot differently if you remember that than if you don't remember that.
Yeah, that kind of helps with the panic factor, where you just sort of forget everything.
Yeah. Well, it gives you a minute to like manage your emotional response so that you can attend to their emotional response.
Absolutely. Um, so we've already talked about this a little bit, but what's a situation where a parent would seek your services?
We did talk a lot about that a little bit. So I get I get referrals from doctors' offices when they do the ages and stages questionnaire at the well child check and like the social emotional development is low, or the parents are coming to their doctor because they're concerned about tantrums or clinginess. Excuse me. I get them a lot from schools because the kids are having a hard time with social interactions. Um, and just and again from parents in general because they're worried, they're worried about behavior or tantrums, or like I said, like, or their relationships with the parenting.
Yeah, it's really good to know that other organizations are also like pointing
Mhm.
people towards you. That's really good to know. Um, yeah, so do you ever suggest resources outside of your organization to help parents with mental health challenges? And if so, what?
Oh my gosh. Okay. Well, so I mean, so Options does have an adult resource team, ART, again, those acronyms, that they that parents can, or adults can do their own mental health assessment. There's there's other places regarding parent like different parenting classes though. So, and I always get it wrong. The Family Connection,
You got
um
it right.
I refer them, but the email or the website is different than the Family Connection. It's like the Family Connects or something like that, and I screw it up
Connects.
every
Yeah.
time. Yeah. um I so there's different websites that I'll refer parents to if they're maybe like they're concerned, but there's not enough to meet like a mental health diagnosis. So like a lot of times parents will come after a separation and say, I just want to make sure my kid's okay. Um, and so I have kind of different resources for that. Um, do a lot of talking about like self-care and reframing self-care because parents don't often get the week-long vacation without the kids or the day at the spa anymore. So we talk about making sure that you have the smelly soap that you can wash your hands with, or being able to go outside and do something really quick, and that self-talk that you're saying when you're going to do those things. um I think that there's a lot of resources out there, and I think remembering to use them when we remember to use them.
Yeah, definitely. The remembering to use them when we remember to use them. Yeah, I like that. Very cool. Um, so I do want to ask, is there a difference between a PCIT and infant toddler mental health?
There is. So PCIT is a specific therapy. Um, sorry, we mentioned internet stuff. I just got noticed that something in the background shut down. Sorry. The joys of all of doing everything on computer.
It's true.
So
We can still hear you.
infant toddler mental health really is the mental health, the social emotional development of infants and toddlers. So what I'm looking at when I'm evaluating that, I kind of talk about the fact that there's kind of really like there's three clients, because you're looking at the child, you're looking at the caregiver, and you're looking at that relationship that they have. And so there's those pieces that are really important, and it's a small thing. Like I said, if a parent's overwhelmed and dysregulated, I don't know if anybody's ever tried to calm a baby when you're stressed out, but it's a lot harder to calm that baby than if you can relax, and then that baby's going to relax. So there's a pretty concrete example.
That makes total sense. So is there anything that like you want like parents to know about like the resource that you offer, or other resources just kind of in general, or yeah.
Um, I don't know if there's anything that I want them to know. Anybody can do a self-referral. You don't need to go to the doctor to make a call to options. A lot of times people think that you need to have like something, I mean, because the specialty, you have to like get that referral, but you can self-refer. And I guess like what I just, as parents, just knowing like you're not going to be a perfect parent. Like I said, I teach this stuff, and sometimes I don't remember to do it. And the best thing that I do is when I remember to use it, I start using it. Um, and so the more that you can kind of like take a step back and go, you're really upset, instead of quit throwing a fit, the more, the more they're going to go, oh yeah, I am really upset, instead of, you butting heads again.
Gotcha. Yeah, really appreciate that. Um, And I also wanted to say, just for the folks who are in Douglas County, there's also a resource up here called Juniper Tree Counseling, and they have similar practices of infant, toddler mental health and family mental wellness. So they exist. And also, you mentioned parenting classes. Take Root Parenting is also in Douglas County. So in case you're looking for local resources in Douglas. Yeah. So
Very fair.
yeah. Very cool. Feel like there was something else that I wanted to mention, and now I'm forgetting what it is. Let me take a look. Okay, there we go. We're going to go ahead and wrap up, but before we do, I wanted to let folks know that at 12:15, we have a presentation about Purple Cry period, so that we hope you join us for that as well. And also thank you, Brooklyn, for commenting. Yeah, with your struggles dealing with tantrums in your own family. Yeah, definitely. I hope that this helped. Fantastic. All right. Any closing words from you, Sarah?
Yeah, that just kind of made me think that there are just hard times of development, and some misbehavior is typical development. And so there are those hard times. And that's why there's the support of the parenting classes. Hopefully some of the library groups and different things are going to get started again. And so that there's some of that social interaction that kids are needing and craving. But there are those times that it does reach over into a mental health concern, or so, problems with social emotional development. And so there is that balance. And so don't be scared to get that evaluation or reach out to the child's PCP or other people in the community.
Absolutely. Well, thank you so very much for your time, Sara. It's always a pleasure to have you.
Thank you. Yes, once a year I get to see your face. It's nice.
I appreciate it every time. And thank you all for watching. So have a great day, and I hope to see y'all at our next live stream. Have a good one.